Okay, it's 5 in the afternoon on April the 2nd, 2020, and we have a coronavirus update for the state of Alabama. I don't have a teleprompter yet, so you will see me looking down at my phone to update myself on the numbers that we have to present here today. So try to make it short and sweet, and we'll get on with it right now. So as of today, there's 167 new coronavirus cases in the state of Alabama. By the way, you're going to hear the cat rattling the door there, okay? He'll give up in a few minutes. 167 new cases, which takes Alabama to a total of 1,281. That's up from 1,084. And that's about a 15% increase. That's a pretty good increase for a 24-hour period, okay? Now, Alabama's Department of Public Health indicates that they have administered 8,619 tests so far. So, Alabama's doing quite a bit of testing. So, out of those 8,600 whatever tests it was, we got 1,000 confirmed cases. So that's 1 in 8. 1 in 8 that they're testing is coming out positive, okay? And that percentage is going to grow over time because the disease is going to spread for a while here. Now, some differences in cases on an individual county level from yesterday. We've got Clark County with 2 new cases. We've got Coffee County, got 3 confirmed cases. So this is first cases in Coffee County altogether, in Clark County. They've never had cases before. So Coffee County's come up with 3 cases. And Conecuh County has its first case. And Dale County has a new case. So we've got 4 new counties coming on with cases. So just about every county in the state of Alabama is covered now. Got confirmed cases in practically every state, every county in the state. Baldwin County went up from 21 cases to 25 cases. That's 4 additional cases. I'm kind of concerning myself with counties that have 15, 20 or more cases, okay? The onesie-twosies, I'm probably not going to cover them here, okay? Now, Chambers County looks like a huge problem. They have 21 new cases for a total of 66 cases. That's huge for that small population county. I'm not exactly sure what's going on down there, but I hope the state level folks are aware of it because they may be needing help very soon. Elmore County saw an increase from 14 to 17 cases. That's quite a bit of cases there. That's 3 obviously, but 3 is a pretty big percentage on 14. Jefferson County, 19 additional cases. That's a pretty good number given the numbers we've been seeing coming out of Jefferson County recently. Okay, so that's a pretty low number. Percentage wise, nothing like the rest of the state's been going up here, at least in some of the counties, okay? Etowah County, they had 3 additional cases from 10 to 13. Look for them to start going up a bit. Got some urban centers in Etowah County. Lee County, 9 new cases for a total of 91. Lee County's been a sore spot as well. And I've been concerned about them for a while. And they're running, 10% new cases practically every day. Hopefully that will not increase higher, but it may. It may, and of course it may slow down as well. A lot of this is all due to how much testing is actually done. So I think we all know that by now. Madison County up 9 cases to 116. Once again, large urban area in the county. A lot of people traveling back and forth, government work, contractors, so on and so forth. To be expected. Mobile County, they had 13 new cases to make them a total of 69. That's a pretty big percentage-wise jump. It's 23% in one day. Is that due to maybe a delay in reporting? Possibly. Hopefully so. Hopefully they're not seeing 23% daily. They haven't so far, but 23% in one day, that's a lot. Montgomery, 11 new cases for a total of 46. Once again, that's a really large increase. That's in the 30s% percentage-wise increase, or pretty close to 30s. Pickens County, from 4 cases to 9 cases. That's a big increase. I know those are small absolute numbers, but that's a really big increase. 125%. That's a big increase. Shelby County, 10 additional to make them have 99 in total. As I spoke of yesterday, Shelby's next door to Jefferson County, so it's to be expected they're going to have pretty big numbers as well. And they're fairly urbanized as well. They got a lot of people living there, so expect big numbers out of them. Tuscaloosa, they saw their numbers go from 30 to 37. That's a pretty big jump for them as well. So hopefully all these new cases won't turn into fatalities, but we'll see. Speaking of fatalities, Alabama is presenting data in 2 columns now for fatalities. One is possible fatalities and the other is confirmed fatalities. So possible is going to be something along the lines of, well, the person is known to have come in for possible COVID infection, but they also have a heart condition. And it's kind of iffy as to, did they die from the heart condition or did they die from the COVID? Now, Alabama will conduct a COVID-19 test on them, and if it comes back positive, then I'm assuming they will attribute it to COVID, unless it was truly just an out-and-out heart attack, okay? The person perhaps wasn't sick enough, COVID-19 wise, to actually have killed them, at least not yet, okay? So, let's cover the possible fatalities here. Jefferson, they've got another possible fatality, making them 5 in total. They had 1 confirmed case, but Alabama Department of Health removed that from their confirmed and moved it back to possible case. Not quite sure what was going on there. Maybe it was a clerical error that confirmed case accidentally got put into the confirmed, or perhaps a test result came back different than what they were expecting. Who knows, okay? But they have 5 possible cases now. Lauderdale County, they're up to 2 possible cases now. Lee County, they went from 2 to 3 possible cases. I keep saying cases, I'm sorry. Fatalities. Remember, I'm talking fatalities now. Jefferson County with its fatalities, Lee County with its fatalities, and Limestone County with its fatalities. My apologies. Mobile County had another possible fatality, making them 4 in total. So they got quite a few down there right now. Confirmed deaths. Chambers County got a new confirmed fatality, bringing them up to 4 confirmed fatalities. Spoke about Jefferson County and the fact that it no longer has a confirmed fatality. Once again, not sure what went on there. Not sure. Data error? Yeah, probably. Somebody typed it down wrong, maybe. And then Mobile County has had its 3rd confirmed fatality. So Mobile's getting hit pretty hard down there so far. And once again, these fatalities, they aren't like really huge numbers. They're not really monstrously large, but they're absolutely troubling. And they're showing us what's potentially going to come. If we can just keep doing our social distancing, I think we can keep those fatalities to a minimum. And once again, we know that the social distancing, the purpose is so that we can flatten that curve so that not everybody shows up at the hospital at the same time and overloading our hospitals, our doctors, and our nurses, and our first responder network, and everybody else who is taking care of us. We don't want to overload those folks. So the more that we can stay away from other folks, the less we're going to be seeing the doctor folks. Okay? And if you like, go back to the website and take a look at the progressions that I've charting there. Got some nice tables, got some charts, got 3-day rolling averages, 7-day rolling averages, and eventually there will be enough data for 14-day rolling averages and even 21-day rolling averages. Rolling averages will give you an idea as to what the trend is, and you'll be able to, via those charts, you'll be able to see the trend line, and hopefully sooner than later the trend line will turn downwards. That's what we want to see. We want that social distancing to work, and we want those trend lines turning downwards. So that's the update for the day. Thank you for listening. Have a good afternoon. Stay safe, stay away from each other, and God bless you.